Hello, my name is Susan Arnold, and I'm a PhD candidate here at the University of Minnesota, and today I'm going to be speaking to you about mechanisms of resistance to immunotherapy in glioblastoma. Glioblastoma is the most common and the most aggressive primary brain tumor in adults. It's highly resistant to treatment, and even with treatment, the median survival time is 14.6 months. One of the many reasons that glioblastoma is so difficult to treat is that it is very good at evading and also altering the host immune system, leading to both local and systemic immunosuppression. And so theoretically, using techniques in immunotherapy should shift the balance to immune stimulation and allow for the host immune system to help fight against the tumor. But in reality, there's yet to be a phase 3 clinical trial which has improved the survival time in patients with glioblastoma over conventional therapy. And this indicates a need to optimize immunotherapy to provide for an extended survival time in a large proportion of patients. Here at the University of Minnesota, the way that we are investigating this problem is to use dogs as a model for glioblastoma. Canine high-grade glioma is the canine counterpart of glioblastoma multiforme, and it's an excellent model for studying glioblastoma because these tumors have a similar incidence to glioblastoma. They also carry a uniformly poor prognosis in dogs, and although we don't know the exact survival time of dogs with high-grade gliomas, we do know that dogs with primary brain tumors who are treated with palliative care alone live on average about 70 days from the time of diagnosis. High-grade glioma has very similar genetic profile to glioblastoma. 9 of the 10 most commonly expressed mutations in canine high-grade gliomas are also overexpressed in glioblastoma, and they share similar immune microenvironments with a preponderance of CD4 positive T cells, natural killer cells, and myeloid-derived suppressor cells, and a scarcity of CD8 positive T cells. So we have an ongoing clinical trial program going on here, which investigates multimodal immunotherapy for the treatment of high-grade gliomas in dogs. And in a study performed elsewhere, they demonstrated that the survival time for patients with high-grade glioma treated with surgery alone is about 66 days. Comparatively here, dogs that receive an autologous tumor lysate in addition to surgery live about 191 days due to the humoral response to the glioma cells. And furthermore, in a multimodal approach, when dogs receive both tumor lysate as well as an immune checkpoint inhibitor for CD200, those dogs live on average about 381 days and counting. CD200 is an immune checkpoint that glioma cells produce in abundance, and it's highly immunosuppressive. And so by providing an inhibitor, we're able to facilitate immune activation. This is an ongoing clinical trial, and so that means that it's likely that our survival time will actually be longer because many of our patients are still alive at the time of this presentation. An interim analysis revealed something very interesting, and that is that one dog breed alone had a very poor response to immunotherapy in the form of having severe neurological deterioration, severe seizures, and rapid tumor regrowth, and that is the French Bulldog. So French Bulldogs, compared to all other breeds, have a median survival time of 48 days when treated with immunotherapy for their high-grade gliomas. And this marked discrepancy in survival time represents an opportunity to investigate why a subset of patients are poorly responding to this otherwise very promising approach to treating high-grade gliomas. We hypothesized that tumor genetics and the host immune response both contribute to the poor outcome in French Bulldogs compared to other breeds, meaning that French Bulldog tumors are genetically different from tumors in other breeds, and that the French Bulldog immune system responds differently to the tumor and also responds differently to immunotherapy. To investigate this hypothesis, we'll be comparing French Bulldogs to other breeds, both pre and post immunotherapy. We'll be identifying differences in the tumor genetic profiles between French Bulldogs and other breeds using RNA sequencing of banked tumor cells. And we will also be investigating the immune functional differences using immunophenotyping of peripheral blood mononuclear cells, both before and after immunotherapy, and also in healthy and tumor-bearing dogs. We anticipate that given the lack of genetic diversity in dog breeds, that there's a high likelihood that whatever mutations we find in French Bulldogs compared to other breeds are the putative mutations for why high-grade gliomas in French Bulldogs behave differently. We also anticipate that the poor response that's specific to immunotherapy is because of a high likelihood of an altered immune response within the French Bulldog breed. In the future, we hope to investigate whether or not there's a correlation in people. Given that there's a high similarity genetically between canine high-grade glioma and human glioblastoma, I anticipate that a subset of human patients will have similar mutations to what we're going to find in the French Bulldogs. And this will hopefully allow us to develop benchmark tests to predict response to immunotherapy and then to provide adjusted immunotherapy for predicted poor responders. So I want to thank you for your time. I'm very excited to get this research started, and I look forward to providing you with more updates as we get started. Thank you.